Okay, girls, so we're almost at the end. So, congratulations, you made it this far. We're gonna knock this couple of chapters that we have. First of all, I wanted to make sure chapter 53. I know you turned in already your work, and I know you also turned in the exam. So, that first question, I just want to go over it. It says, which of the following would you expect to be absorbed in the least amount of time? It is kind of a tricky question because there are a lot of places in your body where you can absorb things or medications fast. One of them is your gums, like inside. Remember, if somebody is diabetic and they're having an episode where their glucose falls, then one of the things you can do, if they're not reacting, if they can't drink anything that is that has sugar in it or something, then what you can do is put, like, it looks kind of like toothpaste, but that you put like inside the gums, and it absorbs pretty quick. Another example that I can give is the sublingual tablets. One of them is called nitroglycerin, and that one is given to people that have angina or chest pain. So they usually try that nitro little pill, and they put it under the tongue, and it dissolves, and it works pretty quick also. I know actually both of you put the inhalation, which is like maybe an albuterol treatment, and that one is also very good and is very effective. And if somebody is having, like, let's say an asthma attack or something, they do the inhaler and it goes quickly to their lungs, so it's absorbed pretty quick. Another example that I can think about is the EpiPen, the epinephrine. So if somebody's having like an allergic reaction and they get the EpiPen in their thigh, if you remember what we went through with first aid, that one also works pretty quick, and it saves lives. So yes, all these medications work quick, but there's actually one that works quicker than all of them, and it's because it goes directly into the bloodstream. So which one is that? That's going to be your IV. So anything that goes intravenous, anything that goes inside your vein directly, it's going to act like this, quick, because it, like I said, it goes directly to the bloodstream. It doesn't have to go through any other means. So everything else has to go through one place first to go into the bloodstream, but these the IVs go directly into your veins. So that one would be the right answer. Okay, so everything else, I think you did pretty good. Everything else is fine. I saw all the other questions, so you did pretty good. So we're going to go into unit 54. Now unit 54, I put actually some work for you to do, and it's basically doing the key terms, doing the exam at the end, watching the videos. So the videos are talking about how to use a cane, how to use the crutches, and how to use walker. Those are important things that you need to have in mind in case you have a patient that needs them. At least you have an idea of how to educate them. Okay, but this mostly goes into like physical therapy. If you will, if you work with a physical therapist, and or you have somebody that actually needs help with it, then you can educate them. However, I'm not going to go too much into it because, like I said, it's a very particular thing, and unless you tell me yes, we need more of that, then I'm just, going to zoom through it, watch, like I said, watch the videos, do the exam, and I think we'll be good with that information. Now the next one is with nutrition and health. That one I want to take a little pause, and that's what this lecture is going to be about. So I want to do the lecture with nutrition and health. You know that actually that's one of the subjects that I like to talk the most about, because I think it's very important. I think everything, all the health, is based on how you nurture your body. So it's good to talk a little bit about that. After this, actually, the next chapter, which is chapter 56, it talks about practice management. And that one, I'm not even gonna go into. I don't really think you need to go into it. Anything that has to do with the practice, anything that has to do with where you work, they're going to guide you. They're going to give you all the paperwork that you need. They're going to talk to you about human resources, what to do, what not to do, what papers do you have to fill out, and all this kind of stuff. It's going to be important for you, but right now it's not crucial for our lessons. Okay. The next thing that comes here is about emergency preparedness. That's another one that I don't want to talk too much about, and the reason behind it is because we already did it when we did the CPR and the first aid and AED training. We went a lot through everything that had to do with emergency preparedness. So maybe I'll get some little things here and there, but most of the things we talked about already when we did the course for your training. You got certified, so I don't think you need too much of it. And the last one, it says preparing for the world of work. So that one, I just want to kind of talk to you a little bit about what to expect. What are you going to expect, and how are you going to get prepared? Resume, what are you going to put in your resume? Like a letter of references. They're always good to have, good referral from somebody. Also the interview process, how to handle an interview when you're on the phone, or how to handle an interview in person, how to dress. All those kind of things are important, but I would love to do that in person and not have to do it like a lecture or something like that. Why? Because I think it's better, this one in particular, in person, because that way you get to practice and you get to ask more questions and get ready. One of the best things about that is to be confident, to know, I know you're going to be nervous, especially, your first job, and if it's something that you really want, you're going to be nervous the first few times until you actually get the hang of it. Never get discouraged if you don't get the job. Just take it as an experience, and take it like something that you just need to learn. You just need to practice, and it's gonna come. Your job, your dream job, is gonna come. And for now, I know that both of you want to go into school, want to go and graduate as registered nurses, maybe nurse practitioners later on, and that's amazing. But you're going to need a job anyway in that area. Maybe you're going to need a job while you're studying. So I think the best thing, my advice, is to actually get a job in this area, already in the health field, okay? Because this is going to help you a lot. All right, so that's why I want kind of like an in-person, let's say, kind of exit interview of the medical assisting program, because it's going to give you the basics, and it's going to help you, and you're going to learn a little bit more on how to handle the world once you get out there. Okay, so I'm going to leave this video up to just that, and the next one will be just a lecture about nutrition and health. Okay, see you in a little bit.